Most women with cysts in their ovaries never really realize that they have them. Why? Because ovarian cysts rarely cause any symptoms. They form in the ovaries, exist for a while and then shrink and disappear. However, this is not the case with an ovarian cyst rupture. Why? Because a cyst burst is almost always accompanied by symptoms. The following are serious ruptured ovarian cyst symptoms that you should never ignore. 1. Excessive bleeding. When a cyst bursts, it is normal to have a vaginal discharge. This is because when it bursts, the cyst releases its contents. The color and the smell of these contents vary depending on the nature of the cyst. According to Hopkins Medicine, there are times when a cyst burst doesn't just stop at releasing these contents. Since an ovarian cyst rupture involves the tearing of the walls of the ovarian cyst, bleeding can occur. And in most cases, this bleeding is minimal. However, there are times when the bleeding becomes excessive. This can happen due to a pre-existing condition. It can also happen simply because of ovarian cyst rupture complications. Whichever the case, this is something that you should never ignore because the bleeding can limit the amount of blood that gets to your organs. According to Healthline.com, you can even die from this complication. Number 2, fever, dizziness and shortness of breath. If in addition to experiencing sharp pelvic pain and vaginal discharge you start to feel dizzy, feverish and also find it hard to breathe, you should see a doctor immediately. This is because these are common signs of an infection. What this means is that your ovarian cyst rupture has caused an internal infection in your reproductive system. Infections happen because of 2 reasons. The first reason is that the cystic discharge can get trapped in the reproductive system. When this happens, it creates a conducive environment for the development of bacteria. This may then lead to sepsis, something that is usually signified by the onset of these symptoms. The second reason is the cystic tear. An ovarian cyst rupture is usually accompanied by the tearing of the walls of the cyst. This creates some sort of wound. When this wound fails to heal quickly, an infection can develop. This infection can end up spreading to your blood, something that will also be signified by shortness of breath, dizziness, a high fever and any other extreme symptoms of ovarian cyst rupture. It is important to note that when allowed to develop, such an infection will lead to septic shock. Death can follow afterwards. These are fatal symptoms of ovarian cysts. And while they are rare, it is always important to be aware of them. Doing this could help save your life.